This morning, we're going to chat about some of the reasons that you may need to see a urologist. And to do that, I want to welcome Dr. Satyendra Persaud. Good morning to you, Dr. Persaud.
Hi, good morning. How are you?
So far, so good. How are you doing?
I'm okay.
Now,
overcast morning in San Fernando.
Say that again?
I said it's an overcast morning in San Fernando.
Ah, okay. All right. Well, that's good to note. That means we might be getting some rain today all over the place. All right. So I want to get into, you're a urologist. Tell me some of the main reasons that people should come to a urologist. Like, why should we go to see a urologist?
So we see, and you were kind of alluding to it earlier, we see women as well, right? So we see the urinary tract, so that's kidneys, urine tubes, bladder, and the urethra, which brings urine to the outside, in both men and women. And we see the reproductive tract in men. So for the reproductive tract in women, that's a gynecologist. So there are overlaps in things that we see for both men and women. So common things that we see in both men and women are kidney stones. I mean, kidney stones very, very common in Trinidad. So we see that's in common. Urinary tract infections in both men and women. Blood in the urine is a definite red flag. You should not ignore blood in urine, nor should you be treated with just antibiotics and discharge, which is a common practice. And for men, prostate cancer, enlarged prostates are the common reasons why we see you should see a urologist or just for screening. Although a urologist does not necessarily need to see you for screening, you can do that with a GP. We see the fallout of that screening process where we take it further once the screening raised PSA has been detected. Another common reason for both men and women is incontinence. Okay. And we see men for infertility. So oftentimes a couple will go and start getting worked up by a gynecologist, and we'll see the man.
All right. So
enlarged prostates, raised PSAs, blood in the urine.
Yeah. The one I wanna zone in on, because the September is Prostate Cancer Awareness Month. I wanna zone in on the prostate aspect of things. And how, as a man, how do I know if my prostate is enlarged or not? Do I need to see a doctor to know that? Or what are some of the signs that would tell me that?
So the reason we encourage screening is that sometimes you have no symptoms, even with advanced prostate cancer. Now, if you have symptoms of prostate cancer, imagine somebody going to pass urine. Imagine a man trying to pass urine. It'll take him a while to get started. When he does get started, it'll stop and start. The stream might be weak. So the man often comes and says, "Hey, doc, it used to hit the wall and now it's dripping by my toes." When he's finished, there's going to be urine left behind. So he feels as though he still has urine left in the bladder. And then he goes often. So often these men know if they're going to work, they know all the bathrooms on the way to work. And then he might have to go, he gets urgency, so he can't wait to pee. It almost feels like he's going to pee himself. And he gets up at night to pass urine. So those are some of the warning signs, and blood in the urine as well is another warning sign that something might be wrong. But I can't stress it enough that you might have no symptoms. So this is why we encourage men, especially black men in the Caribbean, to get screened when they reach 40.
When they reach 40 is the recommended age?
40. Generally, if you had to take a consensus, we look at 40 with black men in the Caribbean. But at least 40 to 50, you should start getting a baseline blood test and a rectal exam. And yes, we do encourage a rectal exam, if possible.
And the rectal exam, I know last time we spoke about it, people have their concerns, and most men have fears about that rectal exam. But yeah. From what I remember, they're saying it's literally just like a fingertip or something like that, yeah?
Yeah. I mean, my colleague Oscar Ocho did this research a while back at the university, and I mean, men have a lot of fears about it. And especially, does it make them less of a man? And this is not just Trinidadian. This is a trend. Yeah. But I mean, when men come in and they have the rectal exam, they look at it, that's it. It literally takes less than 5 minutes, and it could save your life. And there's a reason we ask for the rectal exam. I mean, I often tell men I would rather see you just at least have the blood test than not come in for screening. But if at all, please let us do both. But if at least have the blood test done. And the reason is you can have advanced cancers that have a normal prostate specific antigen. The blood test is normal, but you would only pick that up when you feel the prostate. So we usually encourage both.
Dr. Persaud, you mentioned men should basically go get that test at age 40 thereabouts. but you also mentioned the staggered urination, and then the pain, and then the blood in the urine. I was just curious to know, how bad is it really by the time you get blood in the urine? Because sometimes you may hear, you know, your better half, your other half, your husband, your whichever it is. Sometimes when they go to the toilet, you know, you're hearing the staggering as they get older. And then, you know, they don't take it on, and they don't go to the doctors, which they should. And then the pain comes on. I'm just wondering, you know, the likelihood of blood in the urine and what will likely cause that blood in the urine.
So whenever we hear blood in the urine as urologists, especially painless blood, so meaning you don't get any pain. I mean, often when people get pain and then they get a little bit of blood, it's a kidney stone coming.
Okay.
But when we don't see, when a patient comes in and says, I'm peeing blood, did you have any pain? No? We start worrying about cancer, and this is cancer from the top down. So you have kidney cancers, cancers in the tubes, cancers in the bladder, especially amongst smokers, and prostate cancer. Enlarged prostates can do it as well as connections, and you know, and kidney stones and stones anywhere along the tract. But we tend to worry that and infections, as I said, UTIs in women as well, and it especially can be exacerbated if they are on blood thinners. Yeah. But we tend to worry that this thing might be cancer. So this is why we don't encourage men to just get. What will happen is they might go to the family doctor and get a prescription for antibiotics and take that, and the bleeding just happens to stop, and they never get it evaluated. If you have blood in your urine, you should have it evaluated, and we usually do some scans in the kidney and the bladder, and we usually look in the bladder with a small camera just to be certain, and if it's a man, we'll get a PSA test as well, and we'll examine him just to make sure it's not prostate cancer. So it really requires evaluation, especially if it's painless blood. It shouldn't just be treated with antibiotics.
Dr. Persaud, I want us to break it down for men who may still be wondering, you know. Sometimes, you know, they say if you don't drink enough water, your peel is going to come out like a darker yellow. Is that, what does the blood in the urine look like? Does it look like blood, like the same way we would see blood if you get cut, or does it look like a dark brown? What does it look like when it comes out, so that we just clear on that?
So there are two types of what you call hematuria, right? Hem meaning blood, urea meaning the urine. There's microscopic hematuria, which you can't see with the naked eye, and there's visible hematuria, which looks red, and it can be a variety of shades of red. So it can be bright red, it can be dark red, it can be cola-colored urine. So especially old blood looks almost like cola, or it could even be looking like concentrated urine. So if you have a suspicion, better be safe than sorry and have it checked out.
And for women who may also experience blood in the urine sometimes, I mean, I think from my experience and what I know from women talking, and we tend to talk more than men do, which is, I think, the better thing, that unfortunately could be a sign of cancer. What else can it be for women when you see that blood in the urine?
Most commonly is a UTI, probably at least what we see. But you should have the UTI treated and then recheck the urine to make sure that after you treated the UTI, that the blood is gone. And again, stones along the urinary tract are very, very common in Trinidad. We see a lot of bladder stones that give you irritable type symptoms when you run into the bathroom very often. Right? And sometimes you see microscopic hematuria. We should also stress that not every case is surgical. I mean, sometimes you have kidney problems and microscopic hematuria, which means your doctor did the urine test and he sees blood on his dipstick, or she sees blood on her dipstick. That could be a sign of a kidney disease, especially if the blood comes along with protein in the urine and so on. So it's important to have it checked out. If it's found either on the dipstick or you see blood, have it checked out. Go to your general practitioner at least, or go to your urologist and have it checked out. They're going to do a full evaluation.
Nice. Dr. Persaud, are the concerns the same for pregnant women as well?
They can have hematuria, but they're a kind of special population. They can have stones just like anybody else, and pregnancy is a different physiology. And if you see blood in your urine and you're pregnant, you should check with your obstetrician, who is going to work you up, and if necessary, refer you to a urologist. I mean, we see a lot of stones in pregnancy as well.
And with respect to women, because women do have similar issues as the men do, as you mentioned, with the bladder issues and things like that. And, you know, as I mentioned earlier as well, you know, we would tend to go more to a gynecologist than a urologist unless one was recommended. One thing that I am aware of that women do present with is prolapse. Can you explain what that is? Because I think it's more common than we think it is, and women may not understand what it is and how it can be treated. Can you explain that to us and how it's related to our urinary tract?
Yeah, so you have all these organs crammed into the pelvis, right? And you have the uterus and the vagina. And then behind that you have the rectum, and in front of that you have the bladder and the urine tubes. And especially as women get old and they've had multiple children, the pelvic muscles, these organs are all like a hammock, and they depend on muscles to hold them together and to keep them functioning properly. And then for a variety of reasons, you get damage to the pelvic, the muscles and the ligaments that hold everything together. Some of them can start coming out, and so you have the bladder or you have the uterus prolapsing downwards, which means it can almost come out of the vagina. The bladder can actually push back. So if you look, so women will tell you they're having difficulty passing urine or they're having difficulty passing stool. Some of them do what's called splinting. So in order to pass stool, they have to actually insert the hand into the vagina and push the rectum away so they can actually pass stool. So and it's a very private problem. People don't talk about it, you know. So prolapse just means that something is moving from where it's supposed to be and coming outside. So you can have the bladder coming out and coming into the vagina. You can have the rectum coming out, coming into the vagina. You can have the uterus just started dropping. And I mean, we see it as urologists, but there's a special category of urologists called gynecologists called urogynecologists that do this sort of operation. Although a general urologist can do it as well. And they tack they repair the walls and they tack everything back into place and hold it with sutures. You know, it's a whole specialty almost by itself.
Dr. Persaud, one of the things you mentioned people should see a urologist for is infertility or erectile dysfunction. I'm curious as to, since we've been in this pandemic and we've been receiving vaccines and all that stuff, and people have a concern regarding vaccination and erectile dysfunction, is there any link? Have you been able to see any link in your research or in your work?
No, I haven't. You know, researchers are by nature very cautious people, and they're never going to say with 100% certainty, but I certainly haven't seen that data. You know, I got a vaccine myself, so that should tell you something.
All right, well, that tells us what we need to know. But is there any relation between any form of all these things that we've talking about? Have you seen any sort of relation between any vaccines and any of the health conditions that you guys deal with?
No, not me personally. I have not seen that, nor am I aware of the vaccine having any untoward effect on us as urologists or patients.
All right. So I want you to, before we wrap up, I mean, we know that we have challenges when it comes to men and their health. We know that we have challenges when it comes to men discussing health and men feeling comfortable. What do you say to men out there watching the show right now who may be having some of the challenges and saying, no, I'll get over it, you know what I mean? I'll get over it eventually. I'm gonna just take 2 antibiotics. I'll eat some fruits, make sure I'm in a good place, drink plenty of water. You know, what do you say to those men?
Yeah, you know, men, we use a lot of herbs and we hope that either ignore the problem. If we ignore it for long enough, it will go away, and this is universal. Or we like to use herbs, especially for the enlarged prostate. I mean, if these things are not going to go away, I encourage you, especially prostate cancer, is something that's very treatable. So if you have urinary tract symptoms, if you see blood in your urine, get it treated early before it's too late. I guarantee you're going to regret it if you leave it. And it's good to get it off your chest. I mean, there's nothing you can tell me as a urologist that I have not heard before or seen before. So there's absolutely no need to be ashamed to come into the office. And, you know, whatever happens in the office stays in the office, you know. The digital rectal examination, you'll be over it in 5 minutes. And it could save your life. Think about your loved ones and think about your children and your grandchildren and what they would want as well. And I encourage women to have this discussion with the men. I mean, when we talk PSA screening, we encourage women to bring the men to be screened, you know. Mm-hmm. So I would encourage men to come forward. Do not be ashamed. Get treated or get screened early if you have a problem. get it started early while it's treatable, rather than wait for it to be too late. And you know, we are, as a community, very non-judgmental.
I guess you kind of have to be at this point, right? I want to thank you so much for joining us this morning, Dr. Persaud, and for sharing the information. And hopefully, you know, we'll be able to see some men reaching out and dealing with the things that they need to deal with.
Yeah, absolutely. We need to get a message out there, destigmatize these conversations, and encourage men, especially black men, to get screened for prostate cancer.
All right. Thank you very much, Dr. Persaud. Take care.